So now we're going to talk about how birth control pills work. And I'm Sam, I'm a gynecologist, here we go. All right, so birth control pills, you take them every day. There's a week of placebo pills in some pills, there's a few days in others. Every pill pack is a little bit different. But basically how they prevent someone from getting pregnant is they prevent you from ovulating, meaning there is no egg released. Also, every day you're taking the same amount of hormone. So in taking that balance between estrogen and progesterone, the lining of your uterus always remains really thin. And that is why periods are lighter and less uncomfortable. Now, some side effects of birth control pills that some people have would include emotional changes. Some people may experience a little bit of weight gain or decreased libido. There are so many different formulations. You always have an opportunity to switch what pill pack you're on, and everyone, I always say, is wired differently, meaning neurologically how we're put together is different. So you have to listen to your body, and if it makes you feel bad, let's just find something different. The other thing too with birth control pills is I know there's increased risk of blood clotting and things, and so certainly there are some people who they're not ideal for, and so we definitely work through that from patient to patient. And there's different routes of administration. There's a pill that you can swallow, there's the NuvaRing you put in the vagina, and the patch. There's different ways to take birth control pills. Some women love to have their period every month because it makes them feel more natural. That's awesome. Then you take it every day as prescribed, and usually you'll have a period maybe just for a few days. Other gals want to have their period the least amount. Totally get that too. I'm not saying there's one way that's right and one way that's wrong, but helping people understand how to do it and take it continuously is nice. Now, when I say continuously, what does that mean? That means that you try to minimize the amount of periods that you have by taking an active pill every day. A little while ago, there was like a pill pack that came out that you take for 3 months and then have your period every 3 months. Now, the reason that's not the most popular pill is because everyone's body is wired different, and you'll get breakthrough bleeding at various times, and so people actually bled more than less. Now, with any monophasic pill, that means any birth control pill that is the same color each week, you can package it yourself if you just understand the principle that when you start spotting, you need to stop taking your pills for a few days. What that also translates into, okay, so when you look at your pill pack, there's 3 weeks and then 1 week off. You take it for 3 weeks. When you get to the 4th week, throw it away. Go to the next pack, take it for 3 weeks. When you get to the placebo week, throw it away. Keep going like that. But when you start bleeding, stop taking your pills for anywhere from 5 to 7 days. Now, why do I say that? If you keep taking your active pills, you will continue to bleed. And you're bleeding when you take continuous birth control pills because that lining gets so thin that you need to bolster it up a little bit. So you bolster it up actually when you stop taking your pills, your own ovaries produce a little bit more hormone, and that stabilizes that lining and that bleeding goes away. That's the way that you take the pills as continuously as possible. Skip as many periods as you can, but minimize that period of breakthrough bleeding. The other thing to remember is when you start taking your pills for the first time. Now, honestly, number one, the whole reason that birth control pills are 28 days is because they looked at a woman's cycle and they're like, hey, most women have periods every 28 days. That's what pill pack should be. That's as scientific as it was. The other thing too is the whole reason they have you start your pills the first Sunday after your period starts is because they think women are more sexually active on the weekend. So that being said, you get to really choose when you start it. And if you start it really with your period when it first starts, whether it's on a Monday or a Tuesday or a Wednesday, you actually will stop yourself from ovulating that cycle. Because when you think of ovulation, if you go back to that normal menstrual discussion that we had before, when your brain's telling your ovaries to ovulate, once the message has been sent, you can't stop it by taking birth control pills. Once your body's on its own course, it has to run its 28 days. So if you start pills in the middle of that, you have your pills going here, you've got your body going here, they don't jive, you get weird bleeding. But if you start taking your pills the first day of your period, then hopefully you stop that message from your brain being sent to your ovaries to ovulate that month. Hopefully your pills take command of that cycle, and then you minimize ovulation that month, and you minimize irregular bleeding that you'll experience. And that's how I counsel patients about birth control pills.